if I remember right. It was in December of 2019. I was having a conversation with Alice Pong, and she was talking about paying attention to what was going on in Wuhan. At that point, I started looking at the CDC and the World Health Organization information, and when I first saw the numbers and the increase, I knew it was just the tip of the iceberg.
A family in isolation at one of the hospitals in San Diego over coronavirus concern.
It started with us in January of last year when they evacuated the U.S. citizens from Wuhan.
And I remember getting a call from leadership in the county, and would we be willing to take the kids? And that's, I think, when it hit me that, wow, this is real. And it's going to come this way, and there's no way we're going to be able to avoid that.
We are reporting this evening the first positive case of coronavirus disease identified for San Diego County. Thank you. We will now take any questions.
And then it started popping up other places, and then there's the question of, can you get infected without having symptoms? A real fear that this virus was just going to take over people's lives.
It's an evolving situation.
This is getting worse and worse.
I never felt so stressed in my life.
There were definitely moments when I was in my third trimester and we didn't know how COVID affected pregnant women. And I'd be putting on my N95 and going in to take shifts, and you don't know what's going to happen.
All of the typical levers that, you run a business on went tilt. There were challenges everywhere.
The coronavirus numbers this Sunday are simply depressing.
It was very, very fast paced. It was very fluid. We just never knew who could be here, who couldn't.
You have the stress of, will I get sick? My job doesn't let me work from home. What's it going to be like showing up with other people who don't have the choice?
The decisions that you were making could potentially be harmful to somebody if you didn't make the right one.
The intent is to test every patient we see. We'll be starting with about 400 tests per day, and over the next 6 weeks, we'll be at 2,000 tests per day.
Rady's had a choice. They could have just maintained what they needed to do, but they didn't stop there. Instead, they saw that fidelity was to help our community that was under attack by a biothreat.
It's coronavirus, and it's a common enemy. Every person who works in the hospital, every child that we take care of is at risk of getting coronavirus. No one is safe.
Did I think it would be like this? No. Did I think it would get as bad as it did for our adult population and everything that we've had to do? No. But let's get ready.
All right, well, you have a good day. This is the space we use as a command center. It's versatile. It is set up with emergency power for lighting, computer access. We have our radios all stored here, all our disaster documentation. Command center, this, Chris? So it looks like a kind of a dumpy old room until it's filled with the people here monitoring and doing all of the jobs. But you've got to keep the structure in place. You've got to do the due diligence. You have to do the follow-up. And probably most important is you have to have incredibly good communication.
"70 years ago, we grew out of an epidemic. I mean, polio, people were locking down. You couldn't go to the pools. You couldn't be around other kids. And out of that grew this amazing institution. But remember, we grew from a crisis. We stepped back and said, mission first, people always. We have to make sure that we're going to be here and we're going to get through this."
Just worry about these two things. How do we take care of the kids in the community? And how do we make sure we take care of our employees? Everything else will work out after it's done.
And that's how it started. Nursing leadership, physician leadership, IT, environmental services, because it's everybody that's involved. Everybody.
Prior to the pandemic, suicide is the leading cause of death for our teens in the United States. We are very concerned about the kids right now.
The physical fear, I think, subsided very quickly, and we very much went into what we could do best and what we could control. And it was about really reducing the anxiety and fear, not only for our patients and families, but for the staff.
We're tired, but we're hanging in there.
Honestly, it's exactly what we signed up for. I don't know if we ever actually realized that until we were in it, though.
And I know that with constant communication and constant changes coming our way, it can feel frustrating at times to feel like we don't have answers immediately.
It's an ongoing process. Everything just kept changing. The numbers are low. So much information was coming in, conflicting information. And that's why we want to have caution.
One of the things that really increased with communication for the employees is the weekly town halls. They've really used the infrastructure that we had in place and used that as a tool for improving communication.
The town halls give us a chance to share information about what's going on a very informal level. But when all of us share our conclusions at the town halls, I think people sense that they're getting a fairly well-rounded commentary. It's the transparency that I think makes it work for communication here at our hospital.
And it was important for us to ensure the public that it was as safe as possible to come here. We're here for you, and this is what we can do, and we're ready.
It makes it much easier to provide support because you know what's going on, and you can communicate that to the employees, you can share that with them, and you're going through the same thing that they are at the same time.
So now we have these technologies in place, we have the process in place. Now it's bringing the people together so that we can collaborate and build these incredible opportunities.
And I think that openness to change and sharing of information as to why we have these policies is a key to our organization.
So in the beginning of the pandemic, there was an immediate shortage of supplies. A lot of people didn't know that about 70% of our personal protective equipment is manufactured actually in Wuhan, China. Our supply chain team does an incredible job with shortages all the time. But now this is with equipment and supplies that we need every day to keep our staff and physicians safe. Then they started looking at your less than normal routes and really exploring every opportunity we had. The innovation that's come out of this organization has been incredible.
So when the pandemic was coming on and we had to kind of ramp things down, we expected there to be a lot less surgeries to happen, and we started to put the machines in kind of sleep mode. But then we got a call from our CEO, Dr. Frias.
Hey Justin, it's Patrick. How's it going?
Why in the middle of a pandemic is a CEO giving me a call right now, in the middle of the afternoon? What is this going to be about?
And how was it after that call?
Yeah. Once again, more stress. CEO says, we have this issue with NP swabs. He had a very specific challenge for us, and that was to create nasal pharyngeal swabs, which wasn't something we had really ever considered on doing.
The PPE shortages were real and significant, and a lot of the swab material for the testing, which was critically important.
And it was just, no one had it, no one was expecting it, so I know Justin in our 3D clinic had designed something that he was able to use his 3D printer to make.
We created 56 different iterations, different sizes and shapes and different dynamics in a very short period of time.
They were able to form a partnership, and the 3D lab was part of that in developing new swabs, which was very instrumental in allowing us to push forward with the testing.
And then to start to see people walking across campus with the face shields that we had designed and produced, that was certainly a rewarding experience as well.
We didn't even know what was possible. And when I talk about how quickly we are able to pivot to be able to take the best care of kids or institute something, and that was a perfect example.
And then similar fashion, how do we provide care at home? We went from 0 to 1,000 in telemedicine and telepresence.
I remember us being advised by our leadership team that we were going to be converting over to telemedicine almost overnight.
It was pure mayhem for about 3 weeks, where we were just literally trying to make sure that these kids were safe and that they had access.
So it was every day, meeting for hours, meeting into the evening time, and getting this to happen in a matter of days to weeks, where some organizations it takes years.
We got to get everybody out of the offices, we got to get them home. That meant building lots of laptops, getting headsets and webcams to people. We even ripped out desktop computers for certain departments parents so they could bring them home.
The month prior, I think we did around 70 telemedicine visits, and then the first month of March, we did close to 4,000, and then close to 16,000 in the next month.
I was very excited when we were able to go live and call our patients and say, hey, we can see you on video. You can still get your care and talk to your doctor.
I heard from your dad that you lost another tooth. Can you show that to me? Oh yeah, right in the front.
400 active users on a yearly basis. Now we're close to 5,000. All of a sudden, when I would tell people that I do Zoom administration, they knew what I did for work. Before, they had no idea what Zoom was.
So now families have more option, and we realize that we can render excellent care. So that flexibility is really going to be incredibly helpful even going forward.
And I think it's allowing people that space to think and to be creative has allowed us to be successful in all these endeavors.
Finding innovative solutions and not barriers, but breaking down barriers at a time of crisis when you need it most.
And some of it was looking to your colleagues left and right of you and realize they were going through their own stress and their own pushbacks, and they were still pushing forward. So we were all in this together, and it really truly felt that way.
So we had this big effort to be able to figure out the right place to be able to do mass vaccination. So we actually repurposed our cafeteria, made it into a part of a business section here, and then we set it up for an easy flow. So they come in from the outside, all of the folks from the community, they get checked in, and then they come through, they get registered. And this is bustling. We have 12 people giving vaccines. We have people waiting in line to be able to get vaccines. Incredibly exciting, and again, yet that next step to really being able to get back to normal.
Yeah, I remember the FedEx guy who came to deliver it had on a Santa hat. He dropped a very simple box onto the loading dock, and we took it back to the pharmacy, and I remember the unpacking of it and thinking those small purple vials of Pfizer was going to bring back life to not only just San Diego, but everywhere that was going to get vaccinated.
When we got the vaccines, we were talking with all the health system leaders at one point, and for us, we can help offload all of you, but you don't have the bandwidth either, and everybody agreed, just let's get everybody vaccinated.
Monday at 5 p.m., the week of Christmas, a colleague calls me and says, hey, I just got off the phone with Chris Abe, our VP of Operations, and if we were going to start to vaccinate the community, could we do that? And I said, well, yeah, sure, we could. When do we think we might need to do this? And he said, maybe by tomorrow at 2 p.m. And I am like moved to emotion talking about my team for this, because they looked at me and I thought, oh my gosh, what are they going to say? And they said, yes, we can. We sure can. They said, this is amazing, we are making history, the community needs us, and in a day we had a vaccine clinic.
That was just incredible when you have people that hadn't been out of their house, hadn't seen their grandkids, to be vaccinated, and to be vaccinated here at Rady Children. They were so grateful.
And I have to say, there was this sense of relief. I mean, my mom just got vaccinated this week. My daughter can visit her grandma by the time she's 1 year of age. That's a huge deal.
Certainly for me, when I talk about mission or what's my true north, it's that, what would I want for my family? I want that for everybody's family.
So to know that the community has a resource like Rady Children's, that no matter what happens with your child, we're going to be here, day, night, weekend, whenever it is, to help care for your child. And we take that very seriously.
I think a lot of us feel a real sense of optimism that it's even going to be better. New ways to work, new ways to take care of people.
But we've never lost that covenant with the community to take care of kids and be the best at taking care of kids.
I just want to say thank you. It was a year ago when we stepped into this. The only way out is to make sure we're all vaccinated and safe and secure. But I also want to thank all the people here at Rady Children who's worked countless hours to make sure that we're ready for this day and for every day ahead of us. So because of all the community together and our partnership with the county and all the other health systems, we're going to get through this thing. So thank you and congratulations on being our 100,000th vaccine.
People, the mission, following your true north, what's right for the kids, and then also collaborating. And it's a real proud moment for everyone involved with Rady Children's.
On behalf of the community, I want to say thank you to everybody at Rady Children's, and you all deserve the credit. And I don't know if you've gotten the credit to the extent I've gotten it, but I don't deserve it. You guys deserve it.
We've learned so much, and resilience, innovation, the team. And I think, I don't think there's anything we can't do.